Let's talk about the fourth one, caffeine abuse and overuse of alcohol. So, in order to do this, we can simply use a dietary log test to monitor intake of caffeine and alcohol and its effect and their effects on the bowel habits. To do so, let's keep a dietary log in which we are measuring the amount of caffeine and alcohol that we take and obviously how it impacts a bowel movement. And for objective evaluation, we can use Bristol stool chart, which I've explained many times. And we can do it for months and weeks and months, and then realize, okay, if there is a direct correlation or causation between our caffeine intake and alcohol intake, then we can confirm that it's because of caffeine and alcohol or alcohol. We don't have to do it pair it. We can isolate one particular variable, which is whether alcohol or caffeine, and we can run this experiment using a dietary log test and then identify the cause of our chronic constipation. And the reason why caffeine and alcohol I mentioned here is both of these elements are diuretic. That what that means is that promotes loss of water through urine, and that will cause contribute to dehydration. And when dehydration happens, obviously the stool becomes harder, it becomes cracks, and it's difficult to pass. Even the stomach lining becomes coarse and dry, so it's difficult to pass. It impairs gut motility. That's how it impacts chronic constipation. So do a dietary log test and identify yourself whether caffeine or alcohol is contributing to your chronic constipation.